Good morning, everyone. Um, Thank you so much for taking time out of your day. We know it's pretty early, but we wanted to kind of get something for y'all this summer semester and introduce y'all to some potential career opportunities in the field of maternal and child health. We're really excited to have these three speakers with us today. Um, and I will just kind of go ahead and let them introduce themselves, just a brief who you are, what you do, and what field you work in. Honor, I'll go ahead and start with you since you're first
Sure.
on my screen.
Yeah, my name is Honor Hill. I'm the director of maternal and infant health initiatives for March of Dimes in Alabama. Long name. Pretty much, I do all maternal and child health work in the state of Alabama for the organization. And so I'll be talking about being a maternal policy analyst and advisor. Amy, do you want to go next?
I'd love to. Thank you. So, hi, I'm Amy Traylor. I'm an associate professor in the School of Social Work at the University of Alabama. I'm also the social work faculty for the Leadership in Adolescent Health, or LEA program at UAB, and have a specific interest in working with children and adolescents in animal assisted services, particularly equine assisted services. And I do that at the Red Barn in Leeds, Alabama. And I'll be talking about what social work is and what that looks like in MCH context. Katie?
All right, I'm Katie Prince. I'm the Vice President of Programs at Big Brothers Big Sisters of Greater Birmingham. And so I'll be talking a little bit about just my role as a program manager at a nonprofit and a little bit of my path on how I got to in this position. So,
Perfect. Okay. Well, we'll go ahead and just get started with each of y'all's presentations and slides. Honor, again, if you want to go ahead and share your screen and get started.
Sure, sure. All right. Let's see if this lets me. All right. Let me know when y'all see it.
We see it.
Cool. Awesome. Okay. So, I'm going to be talking a little bit about policy analysts and advisors. So that's a huge part of my job as the director here for March of Dimes. I have had the joy of spending a lot of time around policy. I'm not going to spend time. If you're interested in this, we can have a conversation about what policy is and the different levels of policy. There's a class for that if you would like it. And I would encourage you to take it if this is an area that you're interested in. But I will start with saying, just setting the scene. So let's say in Alabama, you have a mom who is traveling an hour to go to her prenatal care, but she has no transportation. She shares her car with her husband, but her husband he has to take the car and go do work in another state and come back. There is no public transportation for that. She's having to ask or bribe folks in her neighborhood to take her. When she gets there, maybe she has someone who can take her, but she has to sit outside and wait for someone to pick her up. Her whole prenatal care visit takes 5 hours from driving there, being seen, but then waiting for someone to pick her up. And that means she loses her job because she's missing work days. She's missing times that she should be at work making money to put food on the table. Maybe she has other kids. She's unable to find childcare for them. So they have to come with her to her appointment. Whose job is that to take care of that entire that who has the job to make that change? I will say that it's not just policy that makes that change. The other maternal and child health folks that you'll hear from today are also part of the solution. That But when we're looking big scale, not just one individual person, but when we're hearing stories of women who are driving long distances to get to prenatal care, who are unable to get the care that they need, they might have chronic conditions, but they can't pay for their medication, or they need childcare, but childcare is just way too expensive. Those sorts of things are how we start having this conversation of how do we change that systematically, so throughout the entire state, throughout the entire country, throughout the entire county, if that's a problem. And so that's where this policy analyst or advisor role comes from. See if this will, there we go. Okay, so when we're looking at policy analysts and advisors, I will start by saying an analyst versus an advisor. So when I'm working here, I sit in the role of an analyst as well as an advisor. And so when we think, they're kind of two different roles, and some people have the goodness of being like both, right? Like you can sit in both, but then there's moments where you can't. And so you might see a role that says they're a policy analyst. And that's going to be your policy analyst really studies how these laws, regulations, funding, systems affect the community. So they look at barriers and gaps, but they run the data. Okay, we have data on mom's health outcomes before this law and mom's health outcomes after this law. We have the amount of money we think this is going to take versus the amount of money it actually took. And so that mapping of that data is an analyst. Here's what we know through the data. Here's the barriers we see. And sometimes those analysts are actually able to say, and here are the solutions. And actually, a lot of our professors at the university are able to do that. And so you can sit in both of this, okay, I'm going to run the data, that you can also sit in and here are the solutions. Your advisor is who comes in and starts saying, here are the solutions the analysts brought to us. What are we going to do about it? And what we see with a lot of advisors is they actually have a background in communications, because this is translational science. So if you hear that term thrown around a lot in maternal and child health, this is what it is. Here's the data we have. Here's what we know is true. Now we want to see this actually get implemented so we can see a change. I'm going to give you an example. I had some doctors, some neurosurgeons at Children's. One of them is actually actually a public health practitioner, not just a neurosurgeon. But their group came to me and said, we know through all the data that we've analyzed that if we put folic acid, which is it's B9, B12, it's a vitamin. If we put that into people's foods, we've seen it with flour. If we put that into people's food, our birth defects go down. However, what we're seeing in the data is that there's a large population that we're not seeing those numbers reduced. It's because they don't use flour. They use corn masa. And so we need to replicate that. We have all the data. Here's the data. We need this to change. A policy analyst is the one who looks at that and says, okay, here's all the data. Can we follow the impact? Do we know how much this is going to cost? That is where the analyst gets their hands dirty. And an advisor then takes that and communicates that in a way for people to understand. So what you'll see with analysts is a lot of biostatisticians are analysts, but also folks who just know and understand data or research. And then advisors are usually folks who have some kind of communications background and can distill down all of that data into something people understand. So then we can have solutions and actionable programs. So that's kind of these two paths within this analyst. You can straddle both like I do. You can be one or the other. And what I'll say is that when we look at policy, a lot of people, when they think policy, they're going and they're lobbying and they're going to make change in the government. Yes, that is part of some of what a policy advisor can do. But you might be, when it comes to policy, there's on different levels. Sometimes I'm a subject matter expert and I'm explaining things down to the minute detail, and I want you to think I'm smart, so you listen to me. And other times I'm not the subject matter expert. I'm just trying to explain why we need to do something. And so we can do that on different levels of policy. I say big P policy, which is what you think of, laws, regulations, and little p policy. What do we see actually happen in the hospitals, in the clinics? So you have federal, DC, that sort of thing, state, Alabama, local municipalities, Jefferson County, Shelby County, city of Birmingham. Your hospital systems, that's your little p policy. What is their policy around doulas coming in? Are they visitors? Are they not visitors? Insurance and Medicaid, having Medicaid, little p policy in Medicaid. Hey, for example, Medicaid has a program that does that follows folks with continuous glucose monitors when they have diabetes. They did not have gestational diabetes listed as someone eligible for this monitor. All it did was say, hey, can we include pregnant women in this? And they said, oh my gosh, that was an oversight. Let us change that language. That was not big P policy. That was not a change in the Alabama state legislature. That was literally just talking to Medicaid and them changing a word in the things that they can do themselves without our Congress, the House of Representatives or the senators. And then you have policy, little p policy with professional organizations. What does ACOG, Alabama, the American College of Obstetricians and Gynecologists, say about this? That's who the OBGYNs follow. And then and that's again kind of, you see, we do that through, maybe we change clinical guidelines, maybe we change what people are doing through quality improvement initiatives and that sort of thing. So this happens and you work at many different levels. And so as you're doing this work, realize you have different skills that matter. So you want to be able to analyze data if you're really focusing on that data. Part of my job is not only prepping for the passage of a bill, but then coming back and showing that it works. Hey, we passed postpartum Medicaid extension to 12 months. That's great. Are people using it? What are they using it for? Does that actually result in healthier people? Or are we just paying for something that isn't really resulting in healthier people? Did we miss the mark? And so you need to be able to analyze data and read research so that because sometimes I don't have time to do a full research project, but I can pull up a research paper and tell you what they said, so then we can use that to impact what we've decided to do policy-wise. I understand healthcare financing because when I am doing big P policy, so Medicaid work with pregnant women, I need to understand how it's financed. And then when you get into that advisor role, and even I would say some analysts being able to communicate these very complex ideas in a way that's digestible for people so that they're more willing to put it into practice. Building partnerships, that is a huge portion. You do not have to know everything. Like, I think that there's a big misunderstanding that you have to know everything. You have to have all of the answers in order to make change, to have a policy. That is not true. Policy isn't about having all the answers. It's about bringing together the right people to solve the right problem. So we got to define the problem, make sure it's the right problem, and then we need to get the right people in the room to create a solution. And when you get a bunch of people in the room who might not normally talk to each other, they might think that each person has different goals. So what I do is I say, here are my goals. What are your goals? And how can we make them align so that the thing that we decide hits as many of those goals as possible? So negotiating, what are your goals? What are my goals? How do we find a solution that satisfies as many goals as possible? And then we have to be able to communicate that if you go into this advisor position, if you go into the actual changing of policy or regulation, you have to be able to think strategically, write clearly, and sound professional. And so these skills look different depending on the day. Monday, I might meet with Medicaid about improving their reimbursement. Then Tuesday, I have to review proposed legislation to see if it actually makes a difference. What are the barriers? What are the things they may not have thought about? But I am thinking about it because I spoke to a community member a couple weeks ago, and they said, well, that's not going to work because of X, Y, and Z. So reviewing these things that other people might be proposing and bringing people into the fold to say, well, let's change this a little bit because this is how it's actually going to impact people. Wednesday, I might then meet with all of these different partnerships, right? Hospitals, certified nurse midwives, the physicians, our community organizations, our public health agency, like getting everyone into the room and having this conversation, sitting through that conversation. But then I might Thursday go back to analyzing the data. It could be that all of this is the same policy. It could be that these are totally different regulations that need to be changed. And then I might end up writing briefs, policy briefs, or recommendations, or grant language, or anything like that on Friday. So really the overarching week of what I spend doing these skills, I might jump around, it might be different topics, but I'm constantly asking, what's the problem? Why does it exist? Who's affected? What does the evidence say? And for me, a really big portion of it is those who are affected, what do they say they need? And can we create a policy that could fit that? And then once all of that comes together, who has the authority to make that change? So that is, I'll stop my share and kind of wrap up and say that is what as a policy analyst, and this can go for any topic. I'm currently in maternal and child health. I have so many people who are in childcare legislation and policy. I have folks who are in geriatrics who are thinking through policy for those who might not be able to leave their house because they're disabled or they're within their older years. So they think through policies that affect kind of a population that isn't maternal and child health. And so this talks about maternal and child health as the topic, but I think that policy analysts and policy advisors, that's a role that you might see in multiple different areas. It's just what topic are they focusing on? So that's kind of that's the role that I do, and it's kind of a week in the life. As I said, you're jumping from different portions of that timeline I first showed of what's the problem, who's affected, and how do we make a change.
Wonderful. Thank you so much for sharing that. We will hold off and have a Q&A session for all of our presenters at the end after all three go through. So next, I guess we will just move on to Amy and let her kind of discuss her work in social work.
Okay, let me get organized here. Whoops. Sorry, I am not organized. Let's see, let's try this again. I had this all planned out earlier and it, okay. Okay, here we go. Sorry about that. What crud. I'm so sorry, y'all. Oh, gracious. Okay, here we go. You would think it's Monday morning. Okay, so I'm going to talk with y'all a little bit about about social work in maternal and child health, but really just in general, social work in general. It's such a broad field and really one that, unless you're in it, people tend to misunderstand what it is we do and where it is that we work. So I'm just going to give kind of a broad overview, but also focus on child and maternal health to a certain extent. So, what is social work? So, social work is a professional discipline that's dedicated to enhancing human well-being and helping to meet the basic needs of all people. And we really focus in on those who are vulnerable, marginalized, or oppressed. One of the defining features of social work is our focus on the person and environment perspective, which emphasizes that individual experiences and outcomes are shaped by social, economic, cultural, and political context. So, in maternal and child health, this means recognizing how factors like poverty, racism, housing instability, access to healthcare, and community resources may influence outcomes. Social workers also practice from a strengths-based and empowerment perspective. We identify client strengths and really focus on those strengths, and we provide the resources and support needed to encourage client autonomy so that they can solve their own problems and promote their own well-being. Social workers are trained to work at 3 distinct levels. So you'll see us working at the micro level, which is working with individuals and families directly. You'll see us working at the meso level, so doing a lot of work with groups. And then at the macro level, which is our work with organizations and communities engaged in that policy and what I call big A advocacy work. And Honor talked a little bit about that just a few minutes ago. And so because we can work across and within these 3 levels, that makes us a really flexible and versatile profession. Practice can involve direct support, like counseling or case management, as well as indirect efforts like program development, advocacy, and policy analysis. In MCH settings, social workers are typically addressing issues related um, to client well-being. So think about things like perinatal mental health, intimate partner violence, substance use, child development concerns, and access to social supports. They also play a critical role in coordinating care and helping families navigate complex service systems. So overall, social work is both a helping profession and a change-oriented profession. So we combine compassion with practical assistance and a commitment to addressing the root causes of health and social inequities. So the National Association of Social Workers, or NASW, has a code of ethics that provides the ethical foundation for social work practice across all settings. And it's based on core values. And you can see here our core values include service, social justice, the dignity and worth of all people, importance of human relationships, integrity, and competence. So these values guide how social workers engage with clients, collaborate with colleagues, and advocate within systems. In MCH context, ethical practice could mean respecting family autonomy while prioritizing safety, promoting equity in access to care, or addressing disparities that disproportionately affect marginalized communities. Social workers are often faced with complex ethical dilemmas, such as balancing parental rights with child welfare concerns, or just navigating confidentiality within an interdisciplinary team. The Code of Ethics offers us principles and standards that really support ethical decision making in these kinds of situations. Values like social justice and the importance of human relationships are really relevant in MCH work because trust, cultural humility, and advocacy are really central to effective practice. And across settings, the code reinforces the expectation that social workers will act with professionalism, cultural responsiveness, and a commitment to ongoing learning, ensuring that ethical values are not really just like abstract ideals, but actual practical guides for everyday practice. Okay, so what do social workers do? It feels like we do a little bit of everything, but there are some core roles and skills that are common across most, although not all, positions. So, central to social work is relationship building. And Honor talked a little bit about this, and it really resonated because, effective practice really depends on trust, empathy, and collaboration. And social workers also are routinely conducting assessments so that we can understand our clients' strengths, needs, risks, and resources. And this allows us to provide tailored support to that individual, that family, that community. Social workers also engage in care coordination and resource navigation. So we help individuals and families access healthcare, financial assistance, housing, childcare, all sorts of essential supports. Advocacy is another shared function. We can be advocating for an individual client within a hospital system. I call that kind of little a advocacy. Honor was talking about big P and little p policy. In terms of advocacy, I think about little a advocacy when we engage in advocacy for an individual or a family. But then we also have that big A advocacy where we're advocating for policy changes at the community or the state or the national level. Social workers also work extensively in interdisciplinary teams. We love a good team. Um, and also, trauma informed and culturally responsive practice is a common expectation. We recognize the impact that trauma and the importance of honoring cultural identities and lived experiences. Also, documentation, evaluation, and accountability are consistent aspects of practice. And those just ensure continuity of care and program effectiveness across settings. So, in terms of social work and maternal child health, um, we are we're really well suited to working in MCH context because we are a profession that's grounded in a dual commitment to individual well-being and social justice. So we're really well suited to addressing really complex social and physical needs of pregnant people, children, and families. We operate in MCH context at the sort of the intersection of healthcare, behavioral health, social services, and public policy. We support individuals and families during critical life transitions like pregnancy, birth, early childhood development, adolescence, while also working to improve the systems that shape health outcomes. Social work offers flexibility in roles, settings, and levels of practice. And social workers are able to maintain a focus on social justice, working to reduce health disparities and increase well being and health equity at the individual and community levels. But we're not just in maternal child health. We really kind of branch out. So thinking about social work in hospital and healthcare settings, we tend to be integral members of interdisciplinary care teams. If you think about MCH, we could work in OB/GYN clinics, labor and delivery units, neonatal NICUs, pediatric units, family medicine practices, just to name a few. Some of our key responsibilities are things like biopsychosocial assessment, crisis intervention, discharge planning, and connecting families to community resources. We support patients and families who are coping with medical diagnoses, pregnancy complications, premature birth, chronic illness, you name it. We often are looking at social determinants of health and thinking about how we can address those. Things like housing instability, food insecurity, lack of insurance or transportation, all of those things that can affect health outcomes. We also play an important role in screening for mental health issues, substance use, and interpersonal violence. Our work really requires strong communication skills, flexibility, and the ability to collaborate effectively with other professionals. In this case, healthcare professionals. So while the hospital setting or healthcare setting is clinical, the social work perspective really ensures that the care is holistic and family centered. Thinking a little more macro, looking at public health and government settings, social workers tend to focus on population level health outcomes and systems level interventions. So they can work in health departments, Title V MCH programs, early intervention services, Medicaid programs, child welfare agencies, again, just to name a few. Some of our responsibilities in this sort of an arena often include program planning, implementation and evaluation, policy development and analysis, and community outreach. So rather than providing intensive direct services at this more macro level, we're influencing how services are designed and delivered to entire communities or populations. Here, social workers use data to identify disparities, allocate resources, and improve program effectiveness. If we're thinking about MCH, this could involve initiatives to reduce infant mortality, improve access to prenatal care, or support early childhood development. Social workers in these kinds of roles need to understand policy processes, collaborate with community partners, and really balance administrative requirements with a commitment to equity and social justice. So their work demonstrates how social work values can extend beyond just working with the individual to shaping systems that affect healthcare on a broader scale. You can also find us in nonprofit and community-based organizations, and this is a major employment sector for social workers. These settings, again, these are just a few, but can include things like home health programs, family resource centers, domestic violence agencies, early childhood programs, community mental health organizations. I could go on forever with this. But in these sorts of organizations, social workers typically provide direct services like case management, counseling, education, facilitation of support groups. They could also be involved in grant-funded programs that allow for really innovative responses to community needs. They may be the ones writing those grants and leading these organizations. Community-based practice really, it emphasizes accessibility, cultural relevance, and relationship building within the communities that we're serving. That development of those relationships is super important to being able to provide the services that we do. Social workers who are working in these types of settings usually are engaged in advocacy, community education, and partnership building as we address those gaps in services. And while resources may be more limited than in like a larger like healthcare system or a hospital or something, nonprofit settings really allow social workers to be creative and come up with innovative responses to community needs, and then see those like a real tangible impact of their work. It also allows for a development of deeper relationships with families and communities over time. So if you're interested in social work, there are several different sort of levels of education that allow us to practice in different ways. Our bachelor's level, our BSW social workers typically are engaged in that direct care practice, usually providing case management services or what we call generalist social work practice. The MSW level, the master's level, is a more specialized level. If you're interested in, for example, being a mental health professional and providing therapy, you would need an MSW. You don't have to have a BSW to get an MSW. My undergraduate degree was in English. You can go straight into the MSW if it's something you're interested in. And then we have two doctorate degrees. Our clinical doctorate is the DSW that just prepares social workers to engage in more advanced practice and leadership. And then the PhD is our teaching and research doctorate. You are required to have a license if you are providing direct clinical care to individuals, families, and groups. If you're providing if you're working at that macro level in policy, you may not need a license, but it's always a good idea. And those licensure requirements vary from state to state. And like I said, there are so many opportunities for social workers. You can find us in all of the places you expect us to be, and then so many other places. You can find us in libraries. You can find us like where I do a lot of my work in animal assisted service programs. You can find us in sports facilities. Here at the University of Alabama, we have social workers who work specifically with the athletes. There are just a lot of different populations and roles that we can work on, from that community organization on up to Capitol Hill. So to kind of sum it all up, social work it's just uniquely positioned because it bridges clinical care and community systems, individual needs and social justice, and intermediate intervention with long-term change. Social workers bring a holistic lens that recognizes families as experts in their own lives while acknowledging the structural barriers that shape health outcomes. So whether you're working in a hospital, public agency, community organization, wherever, social workers contribute skills that are essential to improving health. And those skills include advocacy, coordination, culturally responsive engagement. So if you're a student who is passionate about supporting families and addressing health inequities, social work offers a meaningful and flexible career path. So by integrating values, ethics, and evidence-based practices, social workers help ensure that healthcare efforts are compassionate, equitable, and effective. And I will stop there and be happy to answer questions later. Thank you.
Thank you so much, Amy. Katie, we'll go ahead and move on to your presentation about program management in public health.
All right, let's see if mine works. All right, slideshow. There we go. All right, so I'm glad I'm going after Amy because I work with a lot of social workers and I've learned so much from them, and I've really I see every day how those two worlds and career paths and expertise just really go together so nicely. So, but my career path has been mostly in nonprofits. Ever since I graduated with my MPH, I kind of went into that nonprofit world. I love it, so I'm excited to share a little bit about just I kind of focused a lot on my path because I think that was always helpful for me when I was in school. So I'll get started. So Like I said earlier, I'm currently the Vice President of Programs, kind of that program manager position at Big Brothers Big Sisters of Greater Birmingham. So our nonprofit is kind of made up, built like many nonprofits, where we have kind of the development side, where it's the fundraising and the grant writing, and then there's the program side that really puts in place and works directly with the families we serve. And so, just briefly, I attended Auburn and got my Bachelor of Science in Nutrition Science, and a little random. And then I went into my MPH program in Maternal Child Health and Leadership and Policy at UAB. So I know many of you know what a nonprofit is, but our specifically, we are a one-to-one mentoring program. So we served about a little over 1,400 youth last year. We operate many programs, but they all operate in that very that idea of we're matching one volunteer with one child. In making those meaningful friendships and relationships that last a long time. And our vision at our nonprofit is just that all youth achieve their full potential. And so just briefly about our agency, that in just the context of how, as a nonprofit, we are under our national Big Brothers Big Sisters of America umbrella. So we're one of over 400 chapters worldwide. We're a United Way funded agency, so we receive funding as a program of United Way, but also receive state and federal funds. We do fundraisers, we receive private donations and contributions, and we serve the Central Alabama area. So obviously most of our work is done out of Jefferson County, Birmingham, and we're definitely growing in Shelby, but we do serve our surrounding counties as well, actually very intentionally at this point, Blount, Chilton, St. Clair, Walker, Winston, and we just opened a satellite office last year in Montgomery. So we do serve a large service area through our programs. And one of the reasons why I love working at a nonprofit and in this role is that our team is made up of such a wide range of backgrounds and experiences and degrees. So I've tended to be kind of unique in my public health background, but we work with social workers and psychology majors, human development and family studies, community health, accounting, PR and marketing, business. So I love that aspect, like I said, because you're working with all different, it's a very team atmosphere because it all kind of takes us to make it happen and make us get closer to achieving our mission. And so just a little bit more, like I said, of my path. I attended Auburn, and then I went to UAB for my MPH degree. One of the best things I think that the MPH degree offered me was that requirement to complete an internship. It just really gave and gives you, and I'm sure you all know, that real world hands-on experience. And for me, it was the door into the nonprofit sector. So my internship was a joint internship between the Autism Society of Alabama and then the Alabama Interagency Coordinating Council. So I think it was kind of the best of both worlds. I got the nonprofit side, but I also saw a little bit into that world of policy and government and just advocating for different changes that we want to see in this space. So that was a great experience. And through that, it gave me, it also, I think that internship is so great because it gives you're meeting people in this world, you're making connections. And I was able to connect with someone who was leading up a new federal grant in our state. It was a statewide grant called Project Launch, which stands for Linking Action with Unmet Needs in Child Health. And so they hired me to kind of build out one of the pieces of this statewide grant around care coordination. So I became the coordinator of a program called Help Me Grow. We're a care coordination program, mostly partnering. We were with 211 Connects Alabama, all around connecting families with young children to services as early as possible, birth to 5. So at first, it was just really building out that program. There was some like bare bones, but let's just say no one gave me a binder and said, this is your job. It was really building out that program and kind of putting in place some structures that we could eventually move to statewide, which we did. We received statewide funding to start serving all 67 counties. So that was a great experience. I was there for about 6 to 7 years, and it really gave me just a lot of experiences working with different people, serving families in that capacity, and it was great. So then we decided to move to Birmingham, and I got this role as the Vice President of Programs at Big Brothers Big Sisters. So I went from staying in nonprofits, but definitely changing populations. So I was working in that birth to 5 space, and now all of a sudden I was kind of focused on youth. So it was very different, but I think that's one true benefit of working in this world is you have so much flexibility and options, and you can really choose to serve just so many different populations, so many ages, and so that's kind of where I landed here. So I think I wanted to just talk a little bit about, especially now that I'm in more of a position that we're hiring. I think I've worked with over 30 interns since I've been in this role. We get social work interns, we get public health interns, and so and then I also just hire a lot of younger staff that are just starting out. And so I think what I've seen as just a real key to success in the nonprofit world is to have that strong work ethic, to have that strong focus on quality and attention to detail. You have to have that empathy for others and wanting to serve families and the clients you serve. You have to be flexible. No day looks the same, but you have to maintain that flexibility while staying organized. So I think I see that people who possess those qualities or work towards possessing those qualities really stand out. And then with an MPH, I think you stand out in this world especially. So I know for me, the MPH, it really gave me those leadership skills. It gives you a sense of knowledge of like needs assessment, program needs, that don't underestimate that, because not a lot of people come in with that knowledge, and that really can help with program management and program leadership. I think my MPH gave me that big picture view, just a knowledge of data. It's so important in nonprofits to be able to document your work, of course, but also to be able to use that data to show your impact, because that's how you get funding. That's how you keep your mission going. So just having that knowledge has really, I think, is always a benefit. Knowledge of working with different populations, again, that hands-on experience with your internship, knowledge of working in different settings and environments. So coming into this world with an MPH really gives you a set of skills that can be unique and really help you stand out and make an impact in the program that you go to serve. And then I just always love to say all the benefits to working at a nonprofit. I know I have 2 kids, and just that flexible work schedule, I think, always helps my mental health. So the flexibility on that end is just, I think, a true benefit. Gaining experience with how to get a lot done with little. So, we don't have always a ton of resources, but it really makes you super efficient and effective, just based on, you can do a lot with what you have. Every day is different. You're never going to get bored. There's always opportunity for advancement or change of interest. Again, I really just, again, is my role right now. staff I have that show that strong work ethic, just willing to go above and beyond. Even though it doesn't look like there's always a path, tends to be ways to make a path for staff like that. So there's less barriers to get the job done a lot of times in our world. Just time off, generous time off. Work family atmosphere. We're all, I think we don't have a lot of drama in our workplace. We're all just here because we have collective passion for our mission. And you spend a lot of time in your life working. Most of us do. And so feeling that you're working towards something and helping others, I think just makes you feel like all this time you're putting into this, is worth it. So I did want to just show a quick video that kind of highlights our mission. This was our big and little of the year. Every year we pick a big sister and a little sister and a big brother and a little brother. Again, our matches last very long typically. So we can match a child in second grade and they stay matched with the same mentor till they graduate high school. So these are like very long-term, impactful relationships that make an impact. So let's see if this works. Can y'all hear that? Did y'all hear the sound? I didn't do my little
No, and it looks like it might be hot, like frozen on our end.
Oh. Okay, I'm gonna try one time, and if it doesn't work, we'll move on. Let's see. Share settings. I know we covered this right before we started, and we'll move on. We'll move on. I know we're short on time anyway, so but I do invite you to go to our website and check out our mission and a little bit of how more to get involved. Every presentation I do, we're always looking for mentors. We have about 70 kids on our wait list in our community-based program at all times, especially male mentors. And so just go to our website. Obviously, we have an enrollment process. We match kids between the ages of 7 and 15. And it's a really great, you're not just showing up on a Saturday and you're done type of volunteer opportunity, but we hear all the time from our volunteers, our bigs, that they get more out of it, they think, than the little brother or little sister they're matched with. So, I invite you to go to our website, like I said, and then this is my email. You can always email me with any questions about the program or about just guidance in your career.
That's all we have for today. Thank you, Ashlyn, for jumping in for the sign off. But thank you again for y'all's time in presenting information from various different fields. And we look forward to getting able to pass this stuff out to the rest of our organization. And that's about it, everyone. Y'all have a great rest of your morning.